Thanks, Anna. So I'm Katie Brown-Johnson with the Evaluation Sciences Unit. Really excited to be here hosting the SMCI lecture. We have a few announcements before we get started, and it looks like they are right. They're heading away. So, and I don't know if we want to do them well. Right. So we've got our SMCI newsletter. Oh, things keep moving. We have our SMCI newsletter that you can sign up for. Did you want to chime in, Anna?
No. Just putting it on, keeping it on the right slide.
Thank you. Yeah. So our big, exciting annual excellence and improvement publication awards are now open. Submissions are due Wednesday, November 5th, 2025. We're looking for all types of peer-reviewed improvement publications that include authors affiliated with Stanford Medicine. So these are papers that have been published or accepted by peer-reviewed journals during the academic year, the Stanford fiscal year 25. So between September of 2024 and the end of August 2025. I would definitely encourage you to apply, even if you think, oh, that article is not improvement. Go ahead and throw it in. You might be surprised. We have 4 award categories: best publication, first authored by a trainee, best publication in adult, best in pediatric, and best focused on healthcare professionals. And I'll just also put a plug in. If you are interested in being a judge, you can email Sam Kling. Being a judge doesn't preclude you from winning, just as a side note. So it just means that you can't weigh in on your own paper. I've done the judging a couple of years, and it was really great to just see all of the papers that were coming out. So I wanted to highlight that. I also want to highlight our upcoming lecture. Great. Yep. On October 28th. So in a couple of weeks, this is a colleague at the VA who will be chatting with us about psychedelic assisted psychotherapy for PTSD. Jason Thompson is a clinician at San Francisco VA. Lastly, we just ask you, to stay engaged. You can put questions in the chat as we go along. Are there any other announcements before we get started? No. Okay. I'm so pleased to introduce Becky Blankenburg. She's a physician with Stanford, MD, MPH. I'm currently the Associate Dean of Graduate Medical Education and a designated institutional official at Stanford. She has been Assistant Dean of Graduate Medical Education, Associate Chair of Education in Pediatrics, and Director of the Pediatrics Coaching Program. She led residency for 13 years as Stanford Pediatrics Residency Program Director and Associate Program Director. What I really want to highlight about Dr. Blankenburg, she is really committed to diversity, equity, inclusion, and belonging. I ran into her through the LEAD program, the Leadership Education in Advancing Diversity. I would encourage you all to consider being mentors with LEAD. If that is a program that she co-developed and is studying. It's a cohort-based GME approach to improving diversity, equity, inclusion, and belonging. And signups are in the spring and summer, so you can hear from us again about that. I just also wanted to highlight that Dr. Blankenburg developed the first GME coaching program in the United States in 2013. We are so pleased to have her with us today to hear more about GME education, challenges, opportunities, and the future. Becky, Dr. Blankenburg, I'll turn it over to you.
Thank you so much, Katie. That was really, really kind. I'm very excited to be here among such great friends and looking forward to having you give us ideas as well. So I'm just going to share screen real quick. All right. Hopefully you can see these slides. It's really nice to be here with all of you, and wanted to give you a little bit of an introduction into who I am, and then our vision for GME and some initial first steps, and would very much love this to be a conversation, and there are some specific places where I'll particularly ask for your input, but always very interested in learning from all of you. So as I said, I'll give a brief intro and then a vision for GME and really what has been our early focus. This is month 10 of this new role that they basically took Ann Doan's role that she had served in for 40 years and Larry Katz-Nelson's role as Associate Dean of GME and put them together into one combined role. So I've been in that role for the last 10 months. So just a brief introduction to me. I have been here at Packard for the last 20, at Packard as a pediatric hospitalist for 20 years, and I will share a bit more. But I'm a very values-driven leader and wanted to be upfront with what my values are. And hopefully you'll see through my story where I develop these values and also where I'm able to use them day in and day out. My values are learning, innovation, diversity, equity, inclusion and belonging, humor, and family, and hope to share those with you. I want to share two big influences that have really influenced me and continue to this day. One was my parents were both public school teachers for K through 6th grade. My dad was a 4th, 5th, and 6th grade teacher, and my mom was a speech therapist for kindergarten through 6th grade. And here we are at Mount Rushmore, actually at my sister's Make-A-Wish trip. That's me in the middle with the blonde hair and the big bangs because it was the 80s, and my sister and brother and parents. Anyway, my parents' view of their role as teachers was much bigger than the individual topics they were teaching. They really saw the children that they were teaching as really the whole, how do we take care of the whole child, the whole community? They would come home to our dinner table and share stories about ways that they had advocated for the children in their classes. They talked to us about children who were unhoused. They talked to us about children who suffered from interpersonal violence, and really their advocacy for these kids and their ability to really see the broader things that we could do structurally to support children and people in general has had a huge influence on me. The other thing, they had this really uncanny belief in the student who was earning a C. Though they expected me and my brother and sister to earn A's, they really always rooted for all learners and really saw each individual learner on their developmental plan. And you'll see where that fits into my life. The other thing that really influenced me was my sister, Paige. She was born when I was 3 years old and was born with hypoplastic left heart. She was an amazing person, lived to be 24. She actually had her heart-lung transplant here. 30 years ago, and lived 6 more years beyond her heart-lung transplant. But Paige, her pediatric cardiologist, was really my introduction to medicine, and he always saw Paige as bigger than her complex congenital heart disease, and really helped my parents figure out, how do you send a child to school when their oxygen saturation is only 65 to 70%. She didn't get her heart-lung transplant until she was 18, so lived the first 18 years of her life with this complex heart disease. He really taught us all, how do you love a child who may or may not make it through the coming week. And until he passed away at the age of 97, he every month would send me a postcard, just checking in on me, and just served such a huge mentoring role in my life, Dr. Warren. So huge thanks to him. And huge thanks to my sister Paige, who definitely was a huge influence on me going into medicine. From growing up in Sacramento, I went to Caltech for undergrad. It was at a time when only 20% of the student population were women, and I saw the role that my mentor, who was a white older gentleman, played an incredible job mentoring and sponsoring me, and I saw the important role that allies can play in one's journey. I then went to U of Chicago for my MD. During medical school, I really felt like we weren't talking about the structures of healthcare that impact health and well-being. And so I took a year and went to Cal to get my MPH. And it was a wonderful year that introduced me to very different concepts and ideas, and really, again, thinking about how structures impact health. I then went to UCSF, where I did my residency, and I was a chief resident at the San Francisco General. And then I have been involved with finishing up. I'm a lifelong learner, so went to University of Illinois, Chicago, where I'm finishing up my Master's of Health Professions Education, and then did training through the AAMC and ACGME, both to learn how to be a DIO and Associate Dean of GME, and also to learn deeper about diversity, equity, and inclusion. And then 20 years ago, I came here as a first good job. I expected to be here a year or two as my husband finished up training, and I fell in love with this place. And I was originally 100% pediatric hospitalist and still practiced 20% time, so 6 weeks a year, and really loved my weeks on service. They very, very much ground me in what I love. I've served a number of educational roles over the years, but just to say that I've really been continually humbled and have learned so much in each of these roles. We have such an incredible group of people here who are really dedicated to education. I found such wonderful innovators. It's been wonderful to be both on the program side and then now on the more central GME side. And I've also really appreciated learning from others across the country and internationally through a lot of national work that I've helped lead. And then just wanted to share my family. So my husband, Steve, is a psychiatrist up at San Francisco VA. And then we have 2 children, Emily, who's 16 years old, and she really loves drama and writing and reading. And then A, who is our 13-year-old child, and they really like coding and robotics, and our life often looks like that middle picture there of complete chaos. And then the picture on the right really shows how I try to bring my children into the work that we do. And that was a wonderful rally that was led by our lead residents and fellows when George Floyd was murdered. So I'm going to pivot now into graduate medical education. I think there's a lot going on both locally and nationally. And I'm curious if you could put in the chat, what do you see as current graduate medical education challenges, both locally and nationally? And then what do you see as opportunities? I'll give you a couple minutes to think through that. And as you're thinking through the challenges and opportunities, or I could invite you to unmute if you'd like to share any. So challenges, restrictions on care in different locations, OBGYN, gender affirming care, the opportunity to cross-collaborate collaborate when it comes to QI projects that support ACGME requirements, but also organizational goals and individualized growth. I love this. All right, as you're continuing to think through, please do, and we can have, we'll definitely leave a lot of time at the end for discussion. All right, so I wanted to share a little bit about where we are as a GME community. So we have 1,570 residents and fellows. We have 180 total graduate medical education programs, both residencies and fellowships. 130 of them are ACGME, and so go by particular accrediting standards. And then of the 50 remaining, there are a number that have different accrediting bodies, though they may not be ACGME. We also have 600 visiting residents who come and visit us each year to do a rotation or two to learn something that they can't get in their home institutions. We have 350 program directors and associate program directors, and then 350 program coordinators. So we have a wonderful, diverse group of constituents and members who are really engaged and interested in improving our GME. And so I wanted to share with you a bit about the vision for the future, but I don't see myself as the sole person up on a rock, but rather a group of us all working together, thinking through what that looks like and how do we build that together. And so wanted to share, over the last 4 years, a group had come together coming in 2021 of program directors, program coordinators, residents, fellows, chairs, members of the C-suite and others, really thinking about what is the purpose of Stanford's graduate medical education, and then what particular aims do we have? And so our mission is to educate and empower the next generation of leaders in medicine by providing premier training in clinical care, scholarship, teaching, and advocacy in a diverse and inclusive learning environment. And the 4 main aims are the educational experience, thinking about well-being, focusing on diversity, equity, inclusion, and belonging, and then our GME community. And so building on this strong foundation, then as I came into my role 10 months ago, leading up to it, and in the first 10 months, I've been doing a lot of a listening tour to best understand, as has our whole team. And really, there are 4 main areas that people have really focused on. First and foremost, at the foundation, there was a strong sense that we really need to build trust and transparency. This was expressed by our trainees, that there needed to be better trust and transparency with the GME office, with with our hospital systems and with School of Medicine. We've also heard that from our educational leaders, and we've heard that from others. On top of that, one of the ways that people said that we could really earn trust is by improving our educational and operational processes, that even if we had incredible communication, if our operational processes don't reflect that, then that would degrade the trust. And so we've been focused on how do we build trust, how do we build our operational processes, and then third, there's a real desire to have better integration across the School of Medicine, SHC, and our affiliated sites. And only on that core foundation, then did people say we can get into all the innovation that we want to do. So as far as building trust and transparency, part of what people said is they want better bidirectional communication and more of a dialogue. And so we've built out advisory councils. We already had a chief resident advisory council, but we've revamped it. When I took over, we only had 2 to 7 people coming to any given meeting, and now routinely about 25 to 30 come. We have the Chair Advisory Council, so a group of chairs who have been providing wonderful advice and guidance. We are developing a Chief Fellow Advisory Council that will start this January. And then we also started a program director advisory council, a program coordinator advisory council, and we're restarting our vice chair of education advisory council. In addition, we've been thinking a lot about how do we share information, and so have revamped our newsletter. We're in the process of revamping our GME website, and then ensuring that our meetings really engage our community. And so really rethinking through and doing needs assessments right now on the different meetings that we hold and how to make the best use of that time. And then we have upcoming retreats, and really the overwhelming conversation that we heard was that we really need to include the why in our communications to explain what we're doing. One of the things that we've done to really build engagement has been to build out chief resident leadership training. We have this started 3 years ago and was initially a single session, and then this year is up to three half-day sessions that our chief residents across GME come together. It's been a wonderful investment we have a member from the School of Business who has been a huge part of this team, as well as leaders across the School of Medicine and the healthcare system. So Nicole Tyson has been leading this work, Stephanie Harmon, Magali Fasciato, Lisa Stefanik, and then we have Sarah Williams, and then we have two wonderful trainees, Tiffany Lee and Liz Nguyen, who have been part of this. In doing the listening tour and thinking about the educational processes, we really heard that there were two areas that could use further support. So in the blue, you will see there parts of GME that we've had all along. So our program educational quality is overseen by our educational team and Pedro Tanaka. Lisa Shea has been leading our work in quality improvement and patient safety with a lot of help from all of you, so thank you. And then Lahia Yamane has been leading the work in diversity, equity, inclusion, and belonging. Well-being is a role that we started 2.5 years ago, and I was leading that work in my prior role. And then in the yellow, you see the two areas that people highlighted we were missing. One was very seasoned program directors highlighted that we needed better support for learners who are struggling and how to better build learning plans, remediation plans, and probation plans, and to have more resources for supporting learners as they are going through these different plans. In addition, people highlighted that they wanted more leadership and professional development. There's an overwhelming sense of how do we help our learners really learn the leadership skills that they need so that they can build within our systems and help us be even more impactful. And this idea that if we don't help them build within our systems, then they will build their own separate systems, but that we could be even more impactful by building together. So someone who will be focused on leadership and professional development. In addition, our educational leaders all said that they wanted further professional development, both those who were new to their roles and those who were more seasoned, thinking about next steps and how they continue to grow. In addition, we've been really working on operational processes and how to make them cleaner and more accurate. And so we've done a lot of work on moonlighting and contracts and program letters of agreement and many others. And then there is a deep desire to have integration across School of Medicine, SHC, Stanford Children's, and our affiliated sites. And so really thinking about how do we better connect both our trainees and our educators across these sites and be able to collaborate more both on educational and on patient care related activities. And then finally wanted to share the vision. So on that core foundation, really being able to innovate. And these were the 5 areas that overwhelmingly people felt like we should be leaders in. The first is around clinical development through clinical coaching. We had the first GME coaching program in the country. And to this date, we have the most developed coaching program in graduate medical education. It's currently across 12 programs. It's been a wonderful collaboration with patient experience, and has been a wonderful way where residents and fellows who are in these 12 programs have a dedicated coach who will come with them on rounds or to clinic or to the operating room, will observe them in their clinical environment and give them an opportunity to debrief later and be able to reflect on how they thought they did, and then give them specific feedback relative to the ways in which they're hoping to grow, and then helping them set goals for the next time. It's been a wonderful way of transforming our learning environment from one that was more gold star focused to one that has been much more growth mindset and focused on learning. The second area that people have highlighted is really this idea of further improving our leadership development and integration into the healthcare systems. And we have been building leadership training for our chief residents. The goal is to build that for our chief fellows, and then really to extend it to all trainees. How do we build leadership for all of our trainees so that they learn how to build and expand upon what we are all doing in the healthcare systems? And to ensure that there's that alignment. I remember early on someone put in the comments about how do we ensure that we have better alignment, both with our quality improvement and other improvement projects, and then just in general. The other ways that we're doing this is we have one of 6 home fellowships in the country. This is a healthcare administration, leadership, and management fellowship. It is for physicians who are interested in learning more about healthcare leadership. And Tiffany Lee is our inaugural fellow. She's here this year and has been a wonderful addition. And then we're also doing this through the Residency Safety Council. And I know many of you have mentored and sponsored the Residency Safety Council projects. And the more and more those align with the overall goals of SHC and Stanford Children's, I think it's going to further help them be even more impactful. The third area people felt like we can really innovate is in the professional development of our educators. How do we become the place that all educators also want to come to and stay at? And so really investing in our program coordinators, our program directors, and other educational leaders, and investing in educational technology to support professional development. The fourth area that we should be national leaders in is really this idea of how do we bring our full selves to the work we do. And we are national leaders in both diversity, equity, inclusion, and justice, and in well-being, having Tate Shanafelt here in well-being and all the work that WellMD and WellPhD has done, and then all the work that has been done both through the Office of Diversity and Medical Education and the Office of Faculty Development and Engagement has been incredible. And how do we further spread that so that people really feel like they belong here in our educational systems? And then finally, you can't be in a talk and not hear about AI. We should be leading in AI. We had the first ACGME Clinical Informatics Fellowship in the country. We have wonderful opportunities with so many who are leading in AI here, and being able to think through how are we going to really asking the important questions of how do we use tools appropriately, what other gaps are there that we can be teaching about in other ways, how do we help others make decisions about developmentally when are the right times to use these different tools, and what ways is it best to use them. There are many, many different ways that we can be leading in this area. And then I'd be remiss not to mention what is going on nationally. This is definitely in the backdrop of a lot of changes going on nationally. Federally, there was a Dear Colleagues letter back in February, really questioning what we could teach in diversity, equity, and inclusion. And so we've been really thoughtful about ensuring that all of our programming, as it always has been, is open to everyone. And so and thinking about how we can teach in ways that are legal and still ensuring the inclusive environment that we're hoping to build. ACGME, our accrediting body, stopped the CLEAR program this year. That was the Clinical Learning Environment and Review program, which really was so innovative 10 years ago to bring together. It was the idea that ACGME, when they came to do visits, would prompt visits with the C-suite and with those in quality improvement to really think about the clinical learning environment. They noted in their letter that they felt like really great work had been done to already bring together those parties. And so moving forward, they hope that that would continue. And certainly we're committed here at Stanford to continuing that work, whether there's an accrediting piece to it or not. ACGME also dismantled their DEI office and removed all of their curricula this year. HHS, I share what the Health and Human Services has shared in that they're now expressing interest in how nutrition is taught and assessed in GME. This is the first time that we've had them express a particular interest in a particular educational topic, and we're waiting to see what ACGME recommends after that recommendation. And then there's been a lot of recent concern about our international medical graduates. Locally, about 8% of our residents and fellows are international medical graduates. Nationally, 25% are international medical graduates. 3 weeks ago, there was a proclamation that new H-1B visas would cost $100,000, which would be prohibitive for us here at Stanford to have new H-1B visa holders. There's a lot of advocacy taking place federally to help everyone understand the impact that would have on healthcare. And hopefully, we hope it will be reversed. In addition, there was a recent proposed change to change how long a J-1 visa is allowed to be used for. From right now, it's allowed for 7 years, and the recommendation was to have it only be for 4 years. Again, this would have a huge impact on all of our any surgical resident who was on a J-1 visa, and most of our fellows would be impacted by this. And then finally, we're continuing to see unionization among residents and fellows nationally, as we have seen at our own institution. Areas of partnership, I would love, and I'm going to stop slides in just a moment, but would love to explore with all of you, how do we integrate residents, fellows, and GME leaders even more into quality improvement, patient safety, strategic planning processes and initiatives, both here and otherwise. We very much look forward to the Quality Improvement Symposium and then are open to any ideas that you have. So perhaps I will stop sharing so I could see all of you, and then would love to take any ideas that you have for partnership or other areas you think we should be focused on.
Thank you so much, Becky. I wonder if everybody can come off of mute and do a round of applause to start. And it's interesting because you asked the question that I was going to ask you to start off, which is, what can we do to help and connect with graduate medical students and trainees? So I'd love for everybody to take a second and just drop in the chat ideas that people have for how to connect with residents and with trainees. And maybe we can go from there unless somebody wants to chime in. Or if you have ideas about how we can support Becky, that was going to be my question to you to get things started.
Yeah, I would love your idea. Like, we really have a vision of how do we help residents and fellows build within our systems. We have such dedicated residents and fellows who really are committed. And I think sometimes there's so much going on that it's hard to convey all the great work that's being done. And so really wanting to connect people so people don't feel like they need to build outside of our systems, but rather how do we all build together? So I would love, yeah, I've been beginning to think with a few people about how do we best bring forward those ideas to engage residents and fellows. I will say Resident Safety Council has been amazing. There are probably about 50 residents and fellows engaged in that, focused on 4 areas that are very aligned with the work that many of you are leading. And yet I've wondered, how do we scale that beyond 50 since we have 1,570 residents and fellows?
Robert, can I invite you to come off mute and share your idea or question?
Yeah, well, thanks for having me. I'm here with one of my colleagues, Dr. Seaman from UC San Diego. This has been a real area of interest for both of us is kind of engaging GME in improvement and across the board. And I was just listing one of the areas that we've been working on over the past few years is to develop a process for a much more visible repository or portfolio of active projects where the submitters would indicate, are we looking for collaborators? What kind of help can we look for, could we use in our project and that type of thing? So that a lot of times our GME trainees may not obviously have the bandwidth to start a project from the ground up, but they may be able to kind of apply their varied skills to projects that are ongoing that need some help. So that was just one area that we're focused on. But I don't know, Greg, if you want to talk about any of the other engagement strategies we have.
Well, just to dovetail on that one, as an incentive for them to engage that way, we built a symposium which we have at the end of each year with some prizes, but mostly with health system leadership and faculty attending to celebrate some of the work that they've done that they show off in poster form. And it's great because it's multidisciplinary, so we have the various specialties represented.
That's great to hear. Thank you so much. We definitely love hearing from other institutions.
Just building on that a little bit, I don't remember who I've had conversations with this about. It's probably Kelly Skeff. But thinking about how to potentially use AI to create things like a repository of active QI projects and who's on, some of that work needs to be done by hand, but is there a way to leverage some of our new tools to be able to get a better handle on who all the players are? Lisa, do you want to chime in about the SMCI Quality Symposium?
Sure. I was just typing as you were talking, Katie, and definitely want to connect with our UC San Diego colleagues about theirs. The challenge we've always had with so the symposium is great, but it's it's an annual event, and we're space limited in that we have room for about 120 or so posters, and we've filled up that venue. So we're strategizing with Becky and Lisa Shea and team on how to improve this year's forum. But maybe our UCSD colleagues could talk about how you get around we've had issues with how much information can be on an improvement project that's static in a repository, And then also just the vastness of this, we have, I don't know how many different, as you know, Katie, improvement programs. And, we're in, like, just to take our advanced course in improvement science, we have 125 probably projects in that alone. And just even keeping that up and being able to, in a smart, efficient way, look up projects, reference projects, access information on projects. It isn't violating any kind of patient confidentiality. It's just been a challenge with all our improvement programs on the SHC and the Packard side that we've had issues on. How do you make all that accessible but not violate any privacy, and also make it searchable and easy to access?
I'd be happy to chime in with, and I'm not saying that our approach is perfect, but do you guys happen to have Koali or Koali Build at Stanford as a platform? It's essentially like a sort of a document / workflow platform that allows you to create, especially for like administrative tasks of routing approval to the next person and various things like that, to create that kind of workflow sequence. But we engage that platform here locally as a way to kind of create sort of a closed loop, somewhat self-curating process for the QI project, where we will have them submit it. It'll get routed to our committee to evaluate whether it meets the criteria to be excused from IRB oversight, for example, and generate a letter for that. But the other kind of addition that we made relatively recently is to build in an annual update process where we'd route to the submitters and then have them provide any interim results, say whether it's still active, that type of thing. And that allows it to essentially close itself out as soon as they say that they're done and fall off the active projects list. And that process has both allowed us to kind of do a better job of understanding sort of what are the projects that are seeing some interim results or not, and then also allow us to figure out what's even active or not, so we don't sort of point people to a 3-year-old project and that type of thing. So we're still kind of like in a early phases of the updated process, but that's helped us kind of manage a bit of the challenge of the curation of this repository.
I had not heard of Koali. I did put the link in the chat. I don't know if we've got anything like that, Becky, here that we use.
Not that I'm aware of, but I'm still learning what what all is being used in all the different areas.
I know this is a little far out, Becky, but I had in mind, as as Robert and Greg were talking, thinking about what if some part of the GME experience was like a scavenger hunt or a bingo card, where it's like, collaborate with someone outside your specialty of interest. It's like one thing, review the list of QI projects, assuming there's a list, and reach out to one of them to connect, attend the annual symposium. Like, I guess, what, if any, potential is there to leverage a gamification and some of the, I'm just thinking about humor as one of your values. It's not exactly humor, but, is there a lever for a choose your own adventure GME crosswalk quality improvement experience?
Yeah, Katie, I love that you bring that up. And Lisa Shea and a team have built out games related to quality improvement. And we always are trying to think of like a menu of choices, because one thing I've come to appreciate in GME is, we have 180 programs, so 180 different curricula that we're convincing program directors to find importance in quality improvement. And I think many do find importance, but are trying to figure out like how do we fit it all in, and so different options may work for different programs. I'm curious, yeah, for those who are on who do have residents and fellows engaged in projects, what have you found to be most useful, or what could we do at the institution level that could help support that further? Or what could help encourage people to be part of be part of your project?
We'll chime in, and please drop a note in the chat if you have ideas or thoughts. You can also, if I then call on you, you can also say that pass, and I'll just share what you've written in the chat. You know, for the evaluation sciences unit, we work with a lot of trainees. You were at the graduate medical education level. So much of it is matchmaking and finding a good bi-directional learning and learning opportunity. And so, you know, we're often thinking about how trainees can be involved because we do papers, because we do research. We're often thinking about how we can get trainees involved in papers, and is that an appropriate fit? And then, you know, and then the next piece is really the challenge is time, and getting a paper or product all the way finished really before somebody goes on to their next position or their next part of training. Like that I think is the time and the matchmaking piece. Sam, I might ask you to chime in if there's something else, because I know you think about that with our group as well.
Yeah, no, I think like what you just said, like it's the matchmaking, but the amount of time to find that match, get onboarded, and then timing it right with their program often becomes a barrier. And I'm not sure how to solve it, but oftentimes we do have like excited students come, and their timing is just a little off, whether they're helping with a paper or like a chart review. We're helping prepare protocol for a chart review that could happen in 4 weeks, but they're available in 2 weeks, and how to align that has been a roadblock that I'm not sure how we should overcome, but I wish we could overcome it, because they're motivated, and it's just all about linking up at the right time.
Lisa, did you want to chime in with your question?
Well, just that, you know, I don't know if Becky has any thoughts on this, but I know it's really hard even for just, you know, rank and file employees to know about organizations' operational priority areas, like there's 4 for SHC and there's 5 that are somewhat similar for Stanford Medicine Children's Health, and just, you know, whether those plans, they're on one piece of paper now. It's probably pretty small font on a regular size piece of paper, but the awareness of trainees of those priorities, and in an attempt to align improvement efforts to be more supported if a trainee is an interest in a particular improvement that aligns with one of those organizational priority areas.
Yeah, I think that's such a great question, Lisa, and something that that a number of us have been talking about, that in the past there wasn't much alignment at all, and over the years more and more the Residency Safety Council has become more and more aligned, and I think there's a lot of opportunity as I said, Residency Safety Council engages about 50 residents and fellows. And so I think there's opportunities to really spread what are the priority areas and helping people build within those for all of our residents and fellows.
Just building off of that, Becky, I think I put in the chat, one of the things I was really struck in your presentation was about the stakeholder engagement. There's just so many opportunities for the advisory councils. And I'll just weave that into some of the patient and stakeholder engagement work that Cassie Bragdon and Sam actually and I have been doing with the long COVID reach program, where we find that in community advisory boards, people ask for like 5 slides at the beginning of each meeting to re-ground them in what the project is. And I wonder, with that, like, it's like a 1 to 2 pager that's really about what the priorities are for Stanford across, like, what would happen if we started each meeting, I mean, even this one, with just a quick review, just as a reminder, these are the Stanford priorities. Like, that could do a lot to harmonize work, just in keeping because I also just like went and searched for that document and I can't find it. I always have to look pretty hard for it. And it's super useful when I identify it. So, Lisa, sorry, go ahead.
Oh, no, I was going to say, I love that idea. I think it really helps to reground everyone. That's great.
And Lisa, maybe our last question or last comment before we let Dr. Blankenburg close us out. Do you want to say anything about the Kindness Coalition?
Yeah, I mean, I'm sure a lot of people on this call are aware. I believe we had a lecture from the folks that put that together, and it was resident-driven initiative that I believe is still in effect now. And just perhaps talking with the folks that came up with that, and then how they've been able to sustain it, and sort of what drove that particular initiative, what was sticky about it that has allowed it to sustain and thrive.
Yes, they've done a beautiful job. That was initially led by 2 first-year residents who brought the idea forward and have done a beautiful job connecting with so many of our different groups. They had a GME well-being grant. They connected with Patient Experience, who helped fund them. I don't know who else, but I know that they've connected with multiple different individuals and really have built that multi-institutional engagement.
Well, thank you so much for leading the charge, Becky.
Thank you
so much,
please.
everybody.
Please let me know how we can be of help, and we look forward to partnering. Thank you.
Fantastic. Thank you all so much. There's information in the chat a little earlier, I think, about CME credit. Thank you all for being here. And thank you again, Dr. Blankenburg, for coming to join us.